for this. There's no pill for this. I should be in a wheelchair.
Hello everyone, and welcome to another of our series of endocrine topics. Today we'll be talking about Graves' disease. Now, Graves' disease is an autoimmune disorder that is characterized by circulating antibodies that activate the TSH or thyrotropin receptor on thyroid follicular cells. This causes an excess production of thyroid hormones, and this causes many of the clinical features of Graves' disease. Graves' disease was first described by Robert Graves, the Irish physician, in 1835. It has a prevalence in population studies of between 0.5 and 1% of the US population. There's also been an incidence reported out of Olmsted County in Minnesota of 30 per 100,000 person years. Graves' disease accounts for 80% of the causes of hyperthyroidism or thyrotoxicosis. Graves' disease usually affects women between the ages of 20 and 40 years of age. However, it can affect women at any age. There have also been cases of Graves affecting children. It can also affect men. There are several associations and possible even etiologies associated with the onset of Graves' disease, beginning with a family history of thyroid, autoimmune disease, or any family history of autoimmune disease. Has also been associated with tobacco abuse, has been associated with psychosocial stress, and also there have been associations with infectious etiologies such as COVID-19 virus and bacterial infections such as Yersinia infection.
It's essential to remember that with hope and the support of loved ones, no obstacle is insurmountable. Symptoms of Graves' disease include weight loss despite increased appetite, warm and moist skin, thin hair, hair loss, and pretibial myxedema, eye protrusion, exophthalmos. Severe cases may lead to visual losses, thyroid eye disease, smoothly enlarged thyroid, fast respiratory and heart rate, along with a hyperdynamic precordium, frequent bowel movements, swelling, nail changes / splitting onycholysis in extremities, neurological symptoms such as tremors and hyperactive reflexes, musculoskeletal issues like weakness, muscle pain, and periodic paralysis in certain ethnic groups, psychiatric manifestations including anxiety, insomnia, mania, and depression diagnosis involves recognizing the clinical features of hyperthyroidism, thyroid eye disease, and an enlarged thyroid, alongside specific laboratory findings. These include a very suppressed TSH level, elevated T4 and T3 hormones, and the presence of TSH receptor antibodies. Treatment of Graves' disease is crucial to prevent potentially life-threatening crises like a thyroid storm, which can lead to multi-organ failure and death. Treatment typically begins with a beta blocker to promptly control the thyrotoxic state, followed by long-term management with an anti-thyroid medication like methimazole. In some cases, continuous monitored therapy with methimazole for 18 months to 2 years can cure Graves' disease. Alternatively, radioactive iodine therapy may be employed, wherein the hyperactive thyroid gland takes up the radioactive iodine, leading to its destruction. This results in the patient becoming hypothyroid within 6-8 weeks, necessitating thyroid hormone replacement with levothyroxine. Surgery is considered a last resort for patients who are unresponsive to other treatments, non-compliant, or have particularly large thyroid glands. It's typically not the initial treatment option. With passion. In this segment, we want to emphasize the incredible power of resilience in overcoming life's trials. It's a force that can sustain us through the darkest storms, guiding us towards hope, healing, and restoration. The stories we'll share today will surely inspire you to find strength amidst adversity. We remember the late U.S. President George H.W. Bush and his wife, Barbara Bush. Their dedication to their family and public service provided them with the resilience to navigate the challenges of Graves' disease with grace and dignity. Gail Devers, the resilient track and field athlete, faced both triumphs and tribulations. Her determination carried her through her battles with Graves' disease, proving that the human spirit is capable of incredible feats. The music industry's trailblazer, Missy Elliott, proved that her passion for music goes hand in hand with her strength. Despite Graves' disease, her unwavering commitment to her craft has been an inspiration to us all. The beloved talk show host, Wendy Williams, openly shared her struggles with Graves' disease, reminding us of the strength in vulnerability. Her journey has touched the hearts of many, teaching us to persevere during life's unpredictable twists. Jamaican artist Vybz Kartel's battle with Graves' disease reminds us of the importance of compassion and support for all individuals, regardless of their circumstances. It shows the strength of the human spirit to endure and rise above challenges. As we conclude today's enlightening journey, let us hold on to the power of hope and determination. Remember, dear viewers, that together, with the support of our loved ones, we can conquer any storm that comes our way. Thank you for joining us on this special episode of Sheldon McKenzie Ministries. If you found inspiration in these stories, don't forget to like, share, and subscribe. Together, we can spread hope and encouragement to the corners of the world. Until next time, may we find strength in our shared humanity. Stay strong.